Hello, everyone, and thank you for joining us for this live and recorded training, Elimination Red Flags, UTIs, and Constipation. I have with me Abby Doyle. I'm Lauren Reynolds, the founder administrator at Home Nursing Care, as you all know, and Abby Doyle is one of our great new nursing supervisors. And so she is going to be leading this training, and it should be lasting, 45 minutes to an hour, and then you get your credit for doing it. So thank you so much. We did make a Spanish version of the PowerPoint presentation, so we will be able to provide that, or you'll be able to download it if you wish to also see it in Spanish, not narrated in Spanish, but you can read it in Spanish. So with that, I'm going to have Abby take it away.
All right. Hi everyone, I'm Abby. So we came up with this program because it's part of our quality assurance. Every quarter, we take a look at what's been going on with our clients. The past few months, we had a few hospitalizations for UTIs and one for constipation. So we thought it would be a good idea to give you guys some tips about what you can look for and how to spot these things before they get to the point where a client needs to go to the hospital. On that note, it is really important that our caregivers are reporting these any issues like that to the nurses so that we can get on top of it, get them to the doctor, get them the care they need. And a reminder is that charting, just in your daily charting or in the communication notes, that isn't notifying us. So we don't get to actually read those every day. If you're just charting it on can time in your notes, we didn't see it. So go ahead and give the office a call. All right, let's get started. Our next slide. Problem number one.
Problem number one. There we go.
There we go.
So okay. That little one.
All right.
Okay.
I'll move that. So urinary tract infections. I'm sure a lot of us already know what these are. They're really common in the elderly though, especially women. The urethra is much shorter, so there's more chance for the bacteria to get up and make it all the way to the bladder. UTIs, if left untreated, they just get worse and worse, and they can lead to sepsis, which is an infection throughout the body, and that can even cause death eventually. So a urinary tract infection is bacteria getting into the urethra or the bladder. These infections generally occur when bacteria from stool or urine that's just sitting in a brief, that brief's been wet for a few hours, bacteria starts to grow. Then it can just travel right on up the urethra and cause an infection. So it's really important that we're changing briefs as soon as possible. We want to make sure that nobody's sitting in a wet or soiled brief for hours. We also, many of us were trained this growing up, always wipe front to back. We don't want to be dragging stool from the back to the front and putting it towards the urethra. Okay. They do this.
I know, right? Next slide.
Okay, next slide.
See, we're new to this kind of. I think we're in the way. There we go.
Yeah,
we're gonna
just
put it
get
there.
that. Okay.
There we go.
There we go. Okay, so normal symptoms in younger people. If you're a female, you've probably had a UTI and felt some of this. That's burning with urination, feeling like you have to go to the bathroom all the time. And then when you start to go, there's really not a lot. It's really painful. It feels like burning, like on fire, and maybe you're not peeing very much, but you just feel like you keep having to go to the bathroom. A urinary tract infection can cause urine to smell worse than normal. It can cause fevers, and a lot of times we'll see blood in the urine, or even cloudy, like you can actually just see that bacteria in the urine. Unfortunately, in the elderly, the symptoms can be really different. They can have none of that pain, none of that urgency or frequency. Like they don't feel anything that a younger person might feel. So sometimes they're confused, they're falling, they're weaker than normal. As a nurse with the elderly, I always just say first thing, check the urine, because it might be a UTI anytime somebody's acting different. So weakness is a big one. Somebody who's normally ambulatory, all of a sudden they're having a lot of trouble getting out of a chair, having trouble walking. I had one client, she would like never fall. She had a UTI, she'd fall like every day. And, you know, it was like, okay, check the urine. She started falling. And every time it was UTI. We see increased confusion, and this one's harder to catch in somebody that is already confused, but you know, you can just, that difference that's overnight, that's what we're looking for, is like, you know, their baseline is kind of confused, and then all of a sudden they're really, really confused and not making sense. They're seeing things. They might have a change in personality and be angry. You know, something like that. We want to check the urine. You can also see poor appetite or nausea, vomiting, anything like that might be a sign that there's an infection in the body. Again, change in personality, increased agitation. That one's common in dementia as well. Maybe they might be having that burning and painful urination, but they can't describe it to us, so they're just angry and unhappy. Another thing we might see is fatigue or tiredness. They're just really lethargic and not wanting to get out of bed. So things to look for. What we do when we know we have a UTI, or well, when we suspect one, is notify the office. We're going to try to get them to urgent care or the doctor to get a urine sample done, and so they can start getting treatment for that. You know, if it is a Friday afternoon or something, it might need to be going to the ER if the doctor's office isn't available to call in a prescription, or you know, urgent care is already closed, something like that. So UTIs are easily cured with antibiotics. They don't have to be a big deal, but if we keep going without treatment, they can get really serious. So what normally will happen is they'll take a urine sample. Sometimes with an incontinent client, they'll have to do a straight catheter, which is not fun, but they'll collect that urine, they'll culture it, have the bacteria grow, and then they can test it and see which antibiotic is going to work best for that specific infection. If they don't get antibiotics, that infection is going to continue to grow up the urethra. It's going to grow in the bladder. It can spread to the kidneys, and eventually it will spread into the blood, causing sepsis. When it gets that bad, they're going to need to be hospitalized. They're going to need IV antibiotics. This is what we really want to avoid, because once somebody's septic, it can go really quickly to organ failure and death. So we really, really want to get these UTIs treated before somebody is septic. Any questions on UTIs before we move into bowel and bladder?
Well, this is what just happened to Bill Clinton. Bill Clinton just had an infection and ended up hospitalized in Irvine. Yeah. So that shows how quickly it can get serious.
Yeah, it can. And you know, once people are elderly and they're not having those normal symptoms, like people can just ignore it. I know sometimes people will drink cranberry juice or treat with azo that turns the urine bright orange, but that's not curing it. So that infection is still growing even though you're treating the symptoms. So it's really important to get it treated with antibiotics.
So not homeopathic teas or, right, you said the azo and all of that.
Yeah.
Over-the-counter stuff is not going to work.
No,
you really need to get treated.
Get that bacteria out of the system. Okay, so we're going to move on to constipation and bowel infections. So constipation, as we know, is really common in the elderly, and which is most of our client population. As people get older, they are more sedentary, they're not moving around. That can cause constipation. Dehydration is a major contributing factor to constipation. So it's important to get enough fluids in your diet, as is fiber. We want to make sure our clients are eating a lot of fruits and vegetables and high fiber foods. A lot of medications that our clients take, especially narcotic pain medications, just slow everything down. So we got to be careful of that. And then as people get older, their body systems are just slowing down. So everything moving through their system is going a little slower. Constipation symptoms. If you notice that your client is straining to have a bowel movement, their stools are small, hard, kind of pebble-like. So that's a sign that they're constipated. If they're complaining of feeling bloated or uncomfortable, if they, might have had a bowel movement, but they're complaining that they still feel like they need to go, they don't feel like, emptied out, that's a sign. Sometimes we'll see the abdomen actually getting bloated and firm because there's just so much stool in their belly. And then as it gets worse and things are actually backing up all the way through their system, people will have nausea and even vomiting. So there's a nice little chart here with some graphics of what stool looks like as it's severe constipation, mild constipation, normal, lacking fiber, and then going into diarrhea. Okay, so the dangers of constipation, it is uncomfortable, but it can actually lead to death if it goes untreated. The stool will continue to harden and stay in the body, and eventually it'll block off the intestine completely. And that's called a bowel blockage. What we're going to see then is vomiting, just really uncomfortable, really bloated, swollen tummy. They're not even able to pass gas. So if they really feel like they have to go and there's no gas coming out, that's a big concern. Now, occasionally we can have a partial blockage where the stool is in the system, but just a little bit's able to get by. And so they'll have all those symptoms of the bloated belly and uncomfortable and feeling like they have to go, but they're actually having diarrhea, just like a little bit, because that's just whatever can get by is getting by. That's kind of a weird thing there. But if a bowel blockage does go untreated, it can actually cause the intestine to rupture. And you can imagine fecal matter getting into the system outside of the intestine. That's going to cause a bacterial infection very quickly and cause sepsis and eventually death. So treatment for constipation, you'll see a lot of our clients are already on these medications. The stool softeners like Colace, like the little red capsules, those are just make the stool softer and easier to pass. Laxatives are actually going to pull water into the intestines to thin out the stool, and those are going to be stimulants as well, causing the body to expel stool. And then fiber supplements, a lot of our clients take something like Metamucil or Citracel, and that's just kind of more of a maintenance, adds fiber and keeps the stool moving in a nice manner. If those aren't working, we have to get a little more severe and go for the rectal medications. We're going to go from the other end if the oral meds aren't working. So start with a suppository, and that's inserted rectally like a little capsule, and that will hopefully produce a bowel movement. If that doesn't work, sometimes an enema will, and that's where you inject fluid into the rectum. So if those don't work, somebody will definitely have to go to the hospital, and they might even need surgery to remove the impaction. So we don't want to get to that point. So the best thing we can do is monitor our clients' stools and try to avoid it getting to the point where they need that treatment. We want to encourage fluids, encourage fiber. A lot of the elderly don't want to drink fluid later in the day because they don't want to have to get up and during the night to pee. But we need to remind them that they don't want to get dehydrated. It's really important to keep everything, keep their body healthy and hydrated. I want to encourage high fiber foods, fruits, vegetables, and whole grains, and also encourage exercise, walking regularly, and just standing up, walking around the apartment a couple times is going to help throughout the day. You want to notify the office or the RN if they haven't had a bowel movement in a few days. You notice that they're really straining and having a lot of difficulty. They're having those hard pebble-like stools, and they're really uncomfortable. You want to notify us, notify the family, and we can start doing some of the medications to produce a bowel movement so we don't get a blockage. If your client is in severe pain and they're not passing gas, they're vomiting, and you know they haven't had a bowel movement in a few days, that's when we want to call 911 because there's an impaction. So if you have any questions about this, give us a call, and we can kind of evaluate the situation. Okay. To summarize, how you as caregivers can prevent hospitalizations. You want to know the symptoms of UTIs and constipation. You want to pay attention to your client's urinary and bowel output and speak up if something seems off. As caregivers, you see your clients all the time and you know them better than pretty much anybody else. So you know if something's going on with them, if they're just a little off. You also want to change briefs as soon as they're soiled. We don't want our clients sitting in soiled briefs. And encourage healthy habits. Encourage a good diet full of fiber, staying hydrated, and exercising as much as they can. Okay.
So Abby,
Yeah.
what medications, what are the names of some medications that might cause constipations? Because caregivers might run across
Right.
them. And so just throw out some of the names,
Like
the common ones.
Norco and Percocet, oxycodone, morphine, any of those. You know, they're great at blocking pain, but they also slow down the GI system quite a bit.
So it sounds like anytime somebody has a surgery
yeah,
or an injury,
absolutely,
that's when you have to be on higher alert.
Yes.
So for example, if a caregiver gets a client that just came home from the hospital, that's probably a higher risk time.
Absolutely. Or they have an injury, you know, they've had an increase in pain recently and they're new on these medications. Because a lot of times the doctors will prescribe them a stool softener along with the pain medication, but it's not always enough. You know, like I said, the stool softener doesn't stimulate a bowel movement. It just is making it a little softer. So that's a great point that following surgery or injury, we got to really look out for constipation.
And it seems like those of us at any age, if we're sitting a lot, then we're going to have a bigger problem with this. Like Absolutely. I think about like a cross-country trip where you're sitting in the car kind of in the same spot for 8 hours at a time.
And probably not hydrating as well.
Right.
Yeah.
Right. So even as we're a little bit younger, we can face these issues as well.
Oh yeah, absolutely. You know, these are good things to look out for in yourself as well.
Right. And I guess if you have any questions or if the client has any questions, they should talk to their doctor about it. Like bring up their concerns. This is like an embarrassing topic for a lot of people, right? Like you're talking about bowel movements and UTIs, but then it's such a big part of our health.
Yeah.
That when you are in healthcare and caregiving is part of healthcare, then it's just a reality.
Yeah.
This stuff comes up and we shouldn't be embarrassed.
And, you know, having regular bowel movements is so important because it's really traumatic, you know, physically and just painfully, comfort wise, to get really constipated and then go through the treatment and, you know, possibly have loose stools or be passing a very large bowel movement, which can be very painful.
Right.
You know, as nurses.
And causing hemorrhoids or tearing and the other problems, right?
There's a lot. So, you know, we always want to encourage our clients to do whatever they can to have more frequent, like regular bowel movements, rather than these kind of up and down, you know, constipated diarrhea.
Right.
It's not really fun for the client. So.
Right. Okay. So at home, think to yourself, what are some of the symptoms of UTI? And let's think about, can we name a couple? In the elderly, what I remember is they may not be able to vocalize it and they may not feel like the burning pain that a woman in her 20s would feel, for example. So they could be irritable and falls. More falls or weakness too. I'm thinking of like somebody who can generally transfer and then all of a sudden can't. Yeah. And it sounds like
you have your sweet old lady that's normally very cooperative and all of a sudden she is fighting you, she's angry. You know, that would be an indication as well.
A UTI is just a good place to start.
Yeah. So really anything that you see, you're with your client, 4 days a week, and on Monday they're fine, and on Wednesday they're just a different person, that might be an indication that they have a UTI, and it's definitely worth getting it checked out.
Right. So just report it, and maybe it's nothing, rather than hoping it's nothing and not reporting
Yeah.
it. Better to be, calling us
Mhm.
or calling the doctor and be like
Mhm.
false alarm
Yeah,
than ignoring a red flag.
absolutely.
Okay, great.
Yeah.
Well, this has been a wonderful and very important training, and we will follow up with a quick quiz just so you can get your credit, and that'll add some training time to you. But we really appreciate you being with us. We really appreciate our fantastic staff. If you haven't met Abby, now you have. You've met her online. And we just want to say thank you and goodbye. Thank you.
Bye.